My name is Samaj Stokes, and I am 10 years old.
Samaj Stokes lives in West Baltimore, not far from where Freddie Gray lived and died. Here, Stokes sees it all.
It's really not good because you see, like, next minute it would be fine one day, and the other day it would be really worse with somebody getting hit or getting hurt or selling drugs or something.
Stokes, a fourth grader, is like many other young people in Baltimore, living with trauma from adverse childhood experiences. That can include exposure to violence, substance abuse, and even having a parent incarcerated like Stokes.
He haven't been there since it was Christmas, Halloween, Thanksgiving, Valentine's Day, or any of that. But he gotta do what he have to do so he can come out and have the time of his life with me and my mom.
Dr. Harolyn Belcher is a neurodevelopmental pediatrician at Kennedy Krieger Institute. She says trauma takes a toll on the body. Those adverse experiences cause the body's central stress response system, called the HPA axis, to kick in.
You get this traumatic exposure, then the hypothalamus sends signals to the pituitary gland, which sends signals to the adrenal gland. And what eventually happens is a production of what we call cortisol, which is a steroid hormone.
Belcher says the body responds with an increased heart rate and releases glucose. A little bit of this is good for you, for example, in a dangerous situation. It's what's called fight or flight.
When you have chronic activation of the HPA axis, that can cause dysregulation of the immune system, of the cardiovascular system, of the endocrine system, and these lead to what we find is increased incidence of obesity, increased diabetes, cardiovascular disease, depression.
So these children need to be identified early and given trauma-informed care. Alexandria Warwick Adams is the director of youth services and Elevate Baltimore. Stokes and other kids from this West Baltimore neighborhood attend the Harambe Center after-school program here.
What it really boils down to is ensuring that kids have a space to be resilient.
At the center, kids get to experience arts and culture outside of school. Warwick Adams says children who have adverse childhood experiences are identified and given trauma-informed care.
Teaching kids how to mind their breaths through yoga and trauma-informed care and other sort of trauma-informed activities. We do arts. It's really creating an opportunity for kids to really sit with their space, sit with themselves, sit with their emotions, and have a safe space to talk about those emotions.
But I be scared when I'm asleep, when I have bad dreams.
You think you could get shot just walking home?
Yes.
Stokes is learning to express her emotions. She can talk about how her environment and the absence of her father makes her feel. And she can tell us what she wants people to know most about her.
I want them to know about me that I just want to be safe.
For the 11 News I Team, I'm Lisa Robinson.